guys, welcome back to another segment on how lifestyle interventions can prevent and reverse type 2 diabetes. So thus far we have talked about how type 2 diabetes comes into existence, the physiology behind it, what it is and why it's important. And the last video went over the macronutrients and the science behind it and how to go about thinking about these macronutrients when eating a plant-based diet. So in this video, I wanted to go over first the evidence behind a whole food plant-based diet in treating and reversing diabetes. And then I also wanted to go over what it takes to actually induce type 2 diabetes remission with intensive lifestyle medicine interventions. And to satisfy this component, I wanted to talk about two key trials that have demonstrated the remission of type 2 diabetes. So if that sounds interesting to you, then just keep watching. Okay, so let's dive into the evidence of a whole food plant-based diet. So there's a 1970s study by Anderson Ward, which investigated 20 men with insulin-dependent type 2 diabetes and had them all adopt a plant-based, predominant, low-fat, high-carb, fiber-rich diet. Just after 16 days, 9 patients were able to eliminate all insulin, and the remainder reduced their insulin requirements by 50%. And one of the longest randomized controlled trials was performed by Dr. Neil Barnard, which included 99 people with type 2 diabetes, which were then randomized into a high-carb, low-fat vegan diet and a conventional type 2 diabetic diet, which was described by the 2003 ADA guidelines. So after 22 weeks, the vegan group had an almost 50% improvement in weight loss and A1C levels than the conventional diet group. So to be more precise, this was a 6.5 kilogram weight loss versus just a 3.1 kilogram weight loss in the ADA diet group. So the A1C levels were able to be reduced by 0.96 points on average compared to just 0.56 points in the control group. At 74 weeks, the vegan group maintained a greater reduction in body weight and A1C. However, this was not statistically significant. And here's a graph demonstrating Dr. Barnard's findings in his study. However, you can see over time there was a gradual increase in the A1C levels as the weeks went on, which is an interesting thing to examine when inducing long-term remission in these type 2 diabetic patients. Furthermore, I wanted to briefly touch on the Mediterranean diet. So this is not specifically a plant-based diet, but there is a lot of evidence behind a Mediterranean diet in promoting health benefits. So this is a well-studied diet showed to improve cardiovascular disease and type 2 diabetes. Specifically, the PREDIMED trial is a randomized controlled trial which included over 7,000 participants with type 2 diabetes or 3 other cardiovascular risk factors. These people were then randomized into the Mediterranean diet, supplementing with either olive oil or nuts. Results were that there was a 30% reduction in myocardial infarction or heart attack, stroke, and cardiovascular disease mortality in a 5-year follow-up. In the PREDIMED reuse sub-study, there was also a 50% reduction in type 2 diabetes in 418 non-diabetic individuals. Another positive about a plant-based diet is that it does not need to be calorie restricting, and this is the fact that I absolutely love about this diet, is why I recommend it to all my patients and to friends and family. So it doesn't need to be calorie restricting to see a positive effect on glycemic control. And this is via the low calorie density, high satiety signaling mechanism, aka the GLP-1 incretin effect. Although there is much evidence for weight loss with severe calorie restriction, including inducing type 2 diabetes remission, the biggest critique is the ability for patients to actually adhere to this diet long term, because it is very hard to restrict yourself to only 600 to 800 calories a day long term, because it's really just not sustainable for the average human being. So in this case, I love to recommend a plant-based diet to individuals who are struggling with calorie restriction in terms of their weight loss journey. A study which demonstrates the benefits of a plant-based diet and without the need for calorie restricting is the BROAD study. So this study randomized people into bi-weekly education sessions on whole food plant-based diet versus the usual care for 3 months. This resulted in a 12.5 kilogram weight loss in the 6-month follow-up and an 11.5 average weight loss at the 12-month follow-up. And no other study to date has achieved this level of average weight loss, which is pretty amazing. This is especially impressive because this was done without calorie restricting or introduction of exercise. Another meta-analysis looking at 15 trials examining a non-calorie restricting vegan or vegetarian diet on people with obesity and type 2 diabetes found that there was an average weight loss of 3.4 kilograms. Which is also pretty impressive because, again, this was done without calorie restricting or any special introduction of exercise into their diets. Another program I wanted to briefly touch on, which also has a lot of great evidence behind the intensive lifestyle interventions in preventing, reversing type 2 diabetes, is called the Complete Health Improvement Program, or the CHIP. And this is also known as the PIVIO. So what it is this is an evidence-based intensive lifestyle medicine intervention program in the US, Canada, and the Australasia region. This program combines the pillars of lifestyle medicine, including a whole food plant-based diet, restorative sleep, exercise, positive social connections, and mental and emotional health. This is an 18-session program, which is spaced over 6 to 12 weeks. And there's data gathered on this program for individuals participating in this program, which showed a 5 to 6% reduction in fasting blood glucose, significant reduction in blood pressure and cholesterol and BMI in just 4 weeks. So if you're interested in learning more about PIVIO, I'll include a link below. It's just pivio.com, I believe. And you can easily sign up for this program for free if your medical provider is already partnered with the PIVIO. So definitely ask your primary care doctor or whoever you're seeing for your routine follow-up if they are in fact a partner of PIVIO, and you can get all of these resources and sessions for free. So the biggest positives in type 2 diabetes is that it does not have to be a chronic and progressive condition. It can be induced into remission with the right intensive lifestyle interventions, which I will talk about in these 2 major trials I have. So before we go into that, I wanted to go over the definition for diabetes remission because it does differ based off of different organizations. So the definition for diabetes remission, according to the ACLM and ADA guidelines, is first an A1C level less than 6.5%. There is no qualifications for the fasting blood glucose with this definition, and the duration has to be for at least 3 months. So basically you have to check an A1C level at month 0 and then 3 months later while you're completely off of all anti-diabetic medications. And if it's still showing an A1C less than 6.5, then you have achieved remission, according to this definition. Other definitions include the 2019 ABCD and PCDs, which also include an A1C less than 6.5. However, also involve a fasting blood glucose level to be at least less than 126. And the duration is also different. It's about 6 months. So without further ado, let's go into these major trials. So the first one is the Counterpoint study. So the aim for this study is to examine type 2 diabetes remission in a calorie restrictive dietary pattern. The design of this study is a case-controlled pilot with a single arm intervention. The population involved here are UK adults aged 35 to 65 years of age, and these individuals were not on insulin. The case studies included 11 individuals, and these individuals had type 2 diabetes for less than 4 years and an A1C 6.5 to 9%, an average BMI of 33. The control studies were only 9 individuals, and these were matched non-diabetic individuals. Basically, they were matched based off of demographic information, but these individuals did not have diabetes to provide kind of a control to see how this intervention functions on diabetic versus non-diabetic individuals. So the intervention was the use of meal replacement shakes. And this involved a supplementation of non-starchy vegetables. So this equaled out to about 600 calories a day for 8 weeks. Participants were counseled on consuming at least 2 liters of non-caloric water to maintain their usual physical activities. And furthermore, they were instructed to stop taking their metformin altogether. The remission criteria here specifically was normalization of beta cell function and insulin sensitivity. And again, as I stated earlier, beta cells are the cells in your pancreas which actually secrete your insulin. And this beta cell function is diminished when you have deposits of lipids in your pancreas, which results from that physiology of type 2 diabetes. So the beta cell function specifically was assessed by the fasting insulin secretion rate. And then insulin sensitivity was specifically measured by suppression of hepatic glucose output by insulin infusion. So for the outcomes, within the first week, all participants had normalization of their fasting blood glucose and hepatic insulin sensitivity. All participants lost about 15 pounds, and furthermore, they achieved a gradual improvement in pancreatic lipotoxicity and restoration of beta cell function. Again, this is measured by the immediate insulin secretion rate, or first phase insulin secretion rate. Major conclusions from this study is that removal of intrahepatic fat, improvement of hepatic glucose output, and normalization of hepatic insulin sensitivity were the early results in calorie deficits prior to any weight loss. Furthermore, reversal of pancreatic lipotoxicity is crucial in restoring the normal beta cell function. And here is a graph depicting the findings that I had just stated. The second study I wanted to go over, which is kind of a companion study actually to the counterpoint, this is called the counterbalance study. The purpose of this study was to examine fasting blood glucose in an 8-week calorie deficit in type 2 diabetes of long and short duration. So the major difference between this study and the first study is a duration with which individuals had type 2 diabetes, specifically looking at individuals who had short-term diabetes, which is termed as less than 4 years, or long-term diabetes, which is greater than 8 years. So for the study design, this was a single-arm intervention with 2 groups. For our population, we had UK adults aged 25 to 80 years of age with short-term diabetes less than 4 years and long-term, which is greater than 8 years. This group did include those who were on insulin, which is another difference from the counterpoint study. The interventions here were the use of these meal replacement shakes, again, the same brand Optifast, with supplementation of non-starchy vegetables. This time this added up to 624 to 700 calories daily for 8 weeks. Participants were also counseled on consuming 2 liters of non-caloric water intake and also maintain their usual physical activity. And they were also instructed to stop taking their metformin altogether. For the outcomes, 87% of short duration and 50% of long duration type 2 diabetes participants achieved a non-diabetic fasting blood glucose level, which was classified as diabetic remission in terms of the study's criteria. The average weight loss here was about 15 kilograms among all participants. Participants also saw a significant improvement in blood pressure and lipid profile regardless of their type 2 diabetes duration. So for the major conclusions, similar to counterpoint study, responders to the calorie deficit tended to have a higher baseline fasting insulin level, thus a higher residual capacity for remission. What this means is with a higher baseline fasting insulin level, they had better function of their beta cells to begin with, and seems like this is required in order to induce remission. Furthermore, the pancreatic beta cell recovery also determines type 2 diabetes remission. So these two conclusions are very, very similar to what we had seen in the counterpoint study. So before I wrap up, I wanted to go over some key take-home points, just because there was a lot of information that was covered in this video. So the first key take-home point is that weight loss is critical in remission of type 2 diabetes. The average weight loss is about 15 kilograms, just based off of these major trials. However, the direct study did find that there needed to be at least a 10 kilogram weight loss to induce remission in 24 months. The second takeaway point is that intensive lifestyle modifications, in addition to adopting a plant-based diet, is required to induce type 2 diabetes remission. This has been shown to be done with comprehensive lifestyle programs which address exercise, mental and emotional well-being, stress relief, and sleep. In addition, long-term follow-up with these programs will help these individuals to actually stay in remission. Furthermore, the fourth point is that the longer the duration of type 2 diabetes, the more intense lifestyle modifications are required to achieve remission. This could be seen in the counterbalance study, which compared short-term diabetic patients with long-term diabetic patients and found that there was not as much success in inducing remission seen in the long-term diabetic group. This is thought to be due to dysfunction of beta cells, but again, it's not impossible, it just requires more intensive interventions and alterations in the lifestyle. And finally, the final take-home point is that a whole food plant-based diet has the lowest risk of type 2 diabetes and can be a therapeutic and, more importantly, a sustainable approach, especially for those who do struggle with calorie restriction in their diet. All right, guys, you made it to the end. Thank you so much for watching. If you enjoyed that content or want to see more of it, please hit the like and subscribe button. It really supports my channel. I'll put out new videos similar to this every week. I really enjoyed making this content for you, and honestly, what I did was just scratch the surface of all the evidence and components out there in terms of using lifestyle interventions to prevent and reverse type 2 diabetes. So if you guys have any questions about what I talked about, please leave a comment below. I love hearing from you guys. Otherwise, I included the links to all the references I used to create this content. I hope you guys have a wonderful rest of your day. Thanks for listening. And as always, stay happy and healthy, and I'll see you guys in the next video. Bye!